Yeah, and no, that's correct, Dr. Burgess. And you know, for anyone who wants to read a pretty convincing argument about that, you know, you read the Sixth Circuit Court opinion in the case. The bottom line is that when the initial approval was done, it was done under, as you know, the FDA requires randomized trials, carefully done. It was up to 7 weeks of pregnancy, and it was done with ultrasounds. Ultrasound was required in the initial studies. The initial studies showed safety and efficacy. To then extrapolate that, well, if you don't do ultrasounds, that's also safe and efficacious. As you know, the ectopic pregnancy rate is 2%. This medication does nothing to end an ectopic pregnancy because of the mechanism of action, of course, is to shed an implanted embryo implanted in the uterus, and obviously an ectopic pregnancy is not implanted in the uterus. So to make two leaps of faith, one is that you go from 7 to 10 without a major randomized clinical trial in the United States, and then to go from a clinician visit, face-to-face visit, with a clinician, as you know, the providers have to have the ability to do an ultrasound. That's one of the requires to be a physician who can prescribe mifepristone under the REMS. To make the leap from that face-to-face with a person who can do ultrasound in the office to now it can be telemedicine online with someone, no face-to-face with the prescriber, and now, oh, by the way, you can get the drug by mail. It's just not the right way for the FDA to do this. You know, we trust the FDA to make proper decisions on safety and efficacy done with, as you know, the gold standard of randomized controlled clinical trials. That was bypassed in these decisions, and it looked like it was bypassed. Honestly, it looked like it was bypassed because you know the history. It changed from administration to administration. Now, Dr. Burgess, as you know, science doesn't change from administration to administration. Medicine doesn't change from administration to administration. This policy changed from administration to administration. All we did was basically what we require is you require face-to-face interaction with a provider. Because again, ectopic pregnancy is a concern. Obviously, there, you know, even under the best circumstances, there's a 0.4, 0.5% serious result requiring either hospitalization, emergency room visit, transfusion, et cetera. So this is a step where, look, we feel, I guess the committee felt that the FDA should go back and revisit this, and they should apply the standards that are normally applied for safety and efficacy.